Period poverty is a global community health dilemma that has long been overlooked. This condition is described as having insufficient access to menstrual products, education and sanitation facilities. Briefly, period poverty means that millions of women are subjected to injustice and inequity due to menstruation. According to trade researchers, it has been proven that many countries are still affected by the period stigma and taboo. Inadequate exposure to menstrual health and its management, lack of education about menstruation, and shortage of access to menstrual products and facilities. They have therefore advocated steps to reduce and slowly eliminate the period poverty issue by conducting more research to increase clinical evidence and future references. Joining us now to discuss these issues related to women's health is a serial health advocate, Chioma Nwigwe. Good to have you with us on Arise News.
Thanks for having me.
All right, Chioma, you're a trained lawyer and a brand strategist. So how did you become a period health advocate that led to founding the Safety for Every Girl Foundation?
Yeah, so in 2017, I was abroad schooling, and a routine visit to my gynecologist revealed that I was latex intolerant. So for 13 years, I have endured extreme discomfort and pain and didn't realize it was my body reacting to the latex in disposable parts. So I decided to look into alternative solutions for myself. Now, one day I was doing the research and an article pops up, Period Poverty, a public health crisis. It was one of the UN agencies. I was intrigued. I had never heard about it. So I went into the article, and as I read, I went through a series of emotions. I had so many questions. How is this pervasive issue? How has this gone unnoticed for so long? Why am I still hearing about it? Just hearing about it. At the time I was studying my master's in international development. So this was definitely my field. And I had never heard about it. And it was in that moment that I decided, okay, if this was something that was impacting so many girls, I wanted to be a part of it. And that was the start of that journey.
All right. What are some of the biggest challenges that you've faced in this area? And is this the most significant learning that you gleaned from this period?
Honestly, even though the articles were alarming, I decided if this was something I was going to get into, I wanted to speak to some of the beneficiaries or potential beneficiaries. So I spent about 3 years researching. I visited some slums, and the stories were jarring. One of the most traumatic stories I heard was from a teacher. She had dropped out of school as a result of period poverty as a younger girl. Until date, she still cannot afford menstrual hygiene products and has to use a combination of tissues and leaves. As a teacher working in a school today, why? Because the 5,000 naira salary between accommodation and feeding and clothing and transportation to work, there's just no room in that budget for menstrual hygiene products. And so I started to think, and I asked them, have you benefited from, charities in the past and all of that? And they're like, yes. But when you visit and it's, you give a disposable products, it lasts for 1 month. So in that moment, I decided, okay, if I was going to do this, I wanted products that were sustainable, products that if I give to one girl, at least she's guaranteed to be out of that period poverty loop for a longer period, which was how we created the initial products we created that have a lifespan of up to 2 years.
All right, Chioma. Now, earlier in January this year, you launched the annual Safety for Every Girl National Essay for Young Girls and Women. Tell us more about it and what has been the response so far?
The response has been incredible. Initially, why we decided to do this? So we spent the last year focusing on distribution of products within indigent communities. But lack of access to menstrual hygiene products is one thing. Lack of access to information is another. We needed to create awareness because a big part of the reason why this public health crisis has gone unnoticed for so long is because periods are shrouded in such secrecy. About 1.8 billion women menstruate every month. So it shouldn't be shrouded in secrecy. We should be comfortable to talk about it, and awareness needed to be created. So we thought an easy competition gets young people involved, gets them thinking, and we're able to bring people together to find more solutions to this challenge. It's not a challenge that we can handle on our own. So involving the community, involving the country, involving everyone in this challenge, creating awareness around it would be an amazing way to tackle the problem. We've received hundreds of applications so far, and we're gearing up to host the first period summit ever global. And again, The whole idea is to normalize conversations around period. We cannot eliminate period if we do not talk about it. And that's what it's all about.
Well said. Well, the essay competition's theme is innovative solutions to combat period poverty. Quite compelling. How can our viewers or their family members participate?
It's very easy. A visit to www.safetyforeverygirl.com provides all of the information one needs. Entry is completely free, and there's 2.5 million naira on the table. So the prizes are, we really wanted to make it inviting enough for people to put in the work, put in the effort to write essays, to think outside the box and come up with solutions that are innovative, out of the box. So that is why we decided to make sure that the prize was at least worthy. And we don't exactly celebrate worthy accomplishments enough. So we wanted to make it meaningful for the participants. So it's simple. Just visit our website. You can also follow us across all social media pages. We're continually posting tips and tricks. On the review panel, we have professors. It's a team of 4 professors that are reviewing these essays and marking. So we're following international best practices to ensure that the essay that eventually wins is actually worthy. And this will be an annual event as well.
All right, Chioma, in view of your efforts so far, has there been some standout ideas or insights that emerged from these submissions? And how do you see these ideas making a real-world impact, especially here in Nigeria?
Absolutely. I have gone through because I did the initial checks to run them through the plagiarism checker and all of that. And I am blown away by some of the ideas that people have put down on paper. And the idea is that at the end of this, maybe we can publish a white paper, share with government agencies, get the government involved in this. We are also looking forward to implementing some of these strategies in our own work as an organization. And so I have been blown away. The response has been phenomenal. The ideas, some of the things that I have never thought about that haven't been implemented in other countries or anywhere in the world, people are really thinking outside the box. And what's amazing about it is that because entry is free, you can actually get responses from both people who are currently experiencing it. They know what it pinches, they know some of the challenges they have, and they're able to propose solutions that we who may be a little bit more privileged, that aren't exactly experiencing it ourselves, may not even think about. So the response has been phenomenal. And I'm looking forward to just collating all of these ideas and working towards implementation over the next couple of years.
Indeed, Chioma. Now, what is one word you have to say about period poverty that the everyday Nigerian may not know about, you think?
37 million. That is the number of women and girls in Nigeria as of 2019 who could not afford menstrual hygiene products every month. That number keeps me up at night, particularly considering that between 2019 and today, the economic situation in Nigeria has become even more dire. 37 million every month. When I go out to purchase products for myself and I'm struggling because the price of products is ridiculous, I think about the 37 million girls who are far worse off than me. If condoms can be free, I don't see why menstrual hygiene products cannot.
Very good. Chioma, just before I let you go, a quick question here. Still talking about period health issues. Where you are currently, what's the awareness like? Yes, the public health sector is not comparable to what we have here in Nigeria, but give us an insight here.
Well, here, for instance, in many public bathrooms, you have access to menstrual hygiene products, right? In many schools, you have access to menstrual hygiene products for free. And that is the situation. That is where Nigeria needs to get to, where offices, companies are compelled to provide products for their employees for free. Schools, you have menstrual hygiene banks, and obviously, I'm not even going to pretend that this is a problem that is unique to Nigeria. It is a global issue, and everywhere in the country, they're continuing to work towards it. Last year, Scotland was one of the first countries to provide access to free menstrual hygiene products countrywide, and that is where I see Nigeria going to. So Nigeria is not alone in this fight against period poverty. It's just that because poverty is endemic in Nigeria, we have a higher poverty rate. It is expected, of course, obviously, it's not surprising that we have a higher number of people who are impacted But then it is a serious issue. It is critical, particularly in Nigeria, because it's affecting school dropout rates. It's affecting other challenges that we already have. It's compounded. And that's why I feel like we need to be more aggressive in addressing these challenges in Nigeria. So it's definitely global. There are issues here, but at least we can see a more decisive effort in trying to combat this challenge.
Indeed. On that note, Chioma Nwigwe, lawyer and founder Safety for Every Girl, would like to thank you for your time.